As I got another rhyme, another rhythm for y'all to listen. I'm never quitting on my mission. I'ma roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing. Better watch the way you going, better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain. Keep on working, open curtains, haters swerving, cause they ain't ready for your final version. Whoa. I'm never gonna give up, fall down, I just gotta get up, yeah.
You're listening to the Tom Ficklin Show on WNHH LP 103.5 FM, your home for community radio. Today's guest host is Holly Hackett.
Good morning, everyone. I'd like to thank Tom for choosing me to guest host his show. I am completely overtaken by gratitude, and today's wonderful topic is Medicare for All. I have brought with me 4 experts in different ways and in different fields, and I would like to introduce them to you now. And the first guest is Dr. Marilyn Vashey. She is from the Southwest, but has happily made her home here in Southeast Connecticut for the last 4 years. She is a psychiatrist and currently works from home part-time, giving her freedom to work on single-payer healthcare through her membership in Physicians for a National Health Program, Connecticut, or PNHP.
Thank you, Holly.
You're welcome, Marilyn. Also joining us is Justin Halloran. He is a 4th-year medical student at the Yale School of Public Medicine. He is currently spending an extra year at Yale doing research in psychiatry and plans to apply into psychiatry residency this year. He is one of the co-chairs and founding members of the Yale Students for a National Health Program, a student chapter of PNHP, which advocates for a universal Medicare for all system. And Rana, you're welcome, Justin. Thank you for being here. Rana Stuller has lived in New London for 26 years. She formerly served on the Board of Education, was a co-founder of the Riverside Park Conservancy. Sorry, Rana, I never get that right. And the Southeastern Connecticut Community Land Trust, is currently on the Planning and Zoning Commission, chairs the New London Greentown Committee, and is a member of Medicare for All Connecticut. She grew up in Philadelphia and developed a lifelong interest in finding ways to help people's quality of life.
Thank you, Holly.
Thank you for being here, Rana. And I see that Claudette has joined us as well. But Justin Paglino, I have a lot to say about him. I have to find all of my parts because he has been so integral in teaching me a lot more. He has a medical degree, training in laboratory medicine, a PhD in virology, and 10 years postdoctoral experience studying oncolytic, I believe that's correct, viruses, which is cancer-killing viruses at Yale's Department of Neurosurgery. He is currently running for Congress again. Oh, Lord. I'm sorry, Justin, but thank you for being here.
That's
I messed that up. I'm sorry.
No, you got it right. Thank you.
Thank you. And my girl, Claudette, who currently works as a community health organizer at Clifford Beers. She is an executive team member of Mothers and Others for Justice. She is a member of Medicare for All Connecticut, and so much more. Claudette, welcome, and thank you for joining us.
Thank you, Holly. Happy to be here.
Thank you. Myself, I have been sick most of my life, and I was taught at a very young age, if you did not advocate for yourself, you would never get what was medically necessary. So I have become a member of Medicare for All Connecticut, PNHP Connecticut, and any organization in the area that helps people get what they deserve because it is medically necessary. And that's enough about me. I know that we have some important questions that come from the community that we always hear. The most important thing that I think we should discuss is what is the difference between Medicare and Medicaid? And currently, right now, what would Medicare for All be? Who would like to take that question?
I can fill that one if that's all right. This is Justin Halloran, the medical student. So Medicare, as it stands right now, is a federally funded program that covers mainly people above the age of 65, as well as people with certain conditions like end-stage renal disease and certain disabilities. Medicaid, in contrast, is a federal and state collaboration. So it's funded both by the federal government and the state, covers low-income people. The income threshold is set by each state individually, and it also covers certain other groups like pregnant women, for example, or young children. In the case of Connecticut, we cover the Children's Health Insurance Program through HUSKY, which is our version of Medicaid as well.
Yes, and I would just add that, when we talk about Medicare for all, we're talking really about improved Medicare for all. We're talking about changing what Medicare is, not just lowering the age from 65 to include everybody, but also eliminating the requirement of co-payments or deductibles, or any payments that the patient has to make, really, and also expanding coverage to include more services. So it would include vision, dental, and long-term care as well. So we're going to talk more about what Medicare for all means, but since we're defining the difference between Medicaid and Medicare, it's also important to understand that Medicare for all would not just be Medicare as it is for all, but an improved Medicare for all.
Thank you, Justin. I think that's really important for people to understand that we don't want to take away services that they're given through Medicaid, which is dental and things like that, to improve upon what they have and to expand what they're able to get as well. In other words, for those of us who are on Medicaid, we have to every year go through this grueling process of paperwork in order to requalify. And they basically want to ask you for your firstborn and paperwork. It's ludicrous when the majority of information does not change. So for me, especially, we would not have to continuously go through the rigmarole of all of the paperwork that the current system asks us for every single year. I think that's a lot of what I particularly want to get across to the audience, is that it's definitely not going to be the same. You're not going to have to jump through every single solitary hoop in order to get coverage. It's not going to be like that.
And yes, I guess as a senior citizen, I just want to add that, the way traditional Medicare is organized right now, there are so many gaps in the coverage that many people do feel obligated to get a Medigap policy to cover things that Medicare does not cover. And though even with those additional policies, things like dental and vision might not be covered. So it isn't just a matter of shopping around every year for your primary insurance, but every year you have to figure out if you need some kind of supplemental plan that will cover things that are not the very, very basic essentials that Medicare conventionally covers.
And I'll step in here too. This is Marilyn Vashey. As a psychiatrist, I see what a crazy patchwork there is for mental health and substance abuse plans, and often intolerably high copays. And on the provider side, an intolerable amount of paperwork to get authorization for services. So under the kind of single payer health plan that PNHP, Physicians for National Health Program, calls for, it all flattens out into services for everybody. Everybody qualifies. Everybody has the same coverage and caps. and nobody has deductibles or copays. The access and the fairness are just light years ahead of where we are now.
And I just wanted to make the point that all that administrative work would be saved as well. I mean, it's a lot of work on the applicants who have to jump through those hoops, but it also is a lot of busy work for administrators who have to decide who's eligible and who's not. And when everyone's eligible, you know, boy, that makes things a lot simpler, and that's just one of the ways in which a single payer system can save money by being more efficient in that way.
Definitely. And when we're speaking of saving money, I would like to just put it out there. Let's talk to the talking points that the that big pharma and the insurance industry speaks with their campaigns when they say your taxes to go up, your taxes are going to go up. My opinion, I see it is perhaps it will be called, and I'm using air quotes here, guys, it will be a tax, but what I ask is use it as your premium. So instead of saying it's a tax, it's basically a premium. That's how I see it balanced now. Does anyone else the same way?
That's an excellent way to put it. Thank you, Holly.
I do think it's also worth mentioning, this is Justin Halloran again, that we say premium, sometimes that makes it sound like it's a product that you're buying. And when I hear that, I would be worried, well, is everyone going to be paying the same price? I think the nice thing about structuring it as a tax, which can be progressive, is that people pay in accordance with what is feasible for their income level. And what that means is that for someone who's already on Medicaid, and maybe we'll get to this, someone who's on Medicaid wouldn't end up being forced to buy a new product that they weren't buying before. It would be commensurate with their income level, which means for many Americans, they would end up saving a significant amount of money off of their premiums, even if they ended up paying a slight increase in taxes.
Yes.
Thank you. Thank you. Exactly the point I was getting to. Thank you. Please go ahead, Justin Paglino.
Yeah, thank you. Yeah, so I just like to point out that there's been so many academic studies that have looked at what a single payer Medicare for all system would cost compared to the current system. Over 20 studies, and even the Congressional Budget Office, which is a nonpartisan institution of Congress that looks at what the financial impact of different bills would be. They've all come out in agreement that this would be a cost-saving reform. Medicare for all is less expensive than our current system, and I think that's resoundingly agreed upon by experts. And so anyone who tells you, oh, we can't afford to cover everyone, we can't afford a system like that, it's simply not true. We can't really afford the current system. It will require rearranging who pays and unwinding some knots of how we structure payments. But in the end, we all save tremendous amounts of money. The estimates are up to $600 billion a year in savings, which is a tremendous amount of money. I mean, it's so large, it's almost as large as the Pentagon budget. And so those savings would be distributed among so many individuals, but also among employers, municipalities, and states that are all currently sharing the burden of cost of healthcare. So a reform that saves so much money every year and extends comprehensive health coverage to all Americans, I just find it to be a very compelling argument.
Thank you, Justin. One of the other things that I would like to put in here is for those who are union members. We have heard that they don't want this, but the majority of the membership does, because they don't want to have to continuously fight for better health care coverage, and they would rather fight with their I know how it works. You know how it works. My brain is not cooperating right now. But, you know, they don't want their health care to always be a contending factor. Just let's take it out. And on a business level, if you do that, then jobs and companies can bid on other things and beat other countries, because right now other countries don't have to put in their healthcare costs because they have universal health care. So that's why they're better competitors, and they usually get the bids of the larger jobs. So that's something to think about as well. But I would like to get back to a health equity lens. You know, right now that's extremely important. And we all know, because we're advocates, that that is a huge issue. But unfortunately, the rest of the world is only just now seeing it because of COVID. What universal comprehensive single payer would do is to help some of that equity gap close. That's my layperson opinion. So I would like to speak to that. If whomever would like to take that first. Marilyn would like to. Go ahead, please.
I am really excited. Now, this gets a little wonky, but where emergency rooms are located and where well-equipped hospitals are located, that's not equally distributed in our country. They're for profit for the most part, and they locate where they can make the best profit, which happens to be in high income areas. So once you take that profit motive out of big institutions like hospitals, then there's no incentive for them to be maldistributed. There is every incentive to try to get their product, their services everywhere, so that they can get reimbursement everywhere. So I think this is going to just dramatically change the access and care. I especially think over and over about the statistics for injury and death to women during pregnancy and delivery. Such a terrible, terrible difference for Black women, Native American women, even Latinx women, compared to upper income white women. Now, not all of that can be attributed to the healthcare system, of course, but a significant proportion will change.
And interestingly,
go ahead, Rana.
To just reinforce Marilyn's point, one of the hospitals in Connecticut, in Wyndham, recently discontinued its obstetrics services. So women who live in that quiet corner of Connecticut have to travel a significant distance when they go into labor. And it's just a concrete example. I think also when Lawrence Memorial Hospital took over Westerly Hospital, they did the same thing because, Pawcatuck is not a high income area. So we're seeing it concretely that community hospitals are discontinuing some of these services in areas where there really still is a need.
And Rana, I think your point also speaks to what kinds of services are actually economically feasible under our current system. If you look at something like emergency room care, it ends up being very expensive for hospitals because they're required to cover people who walk in the door. And what does that mean if you're a for-profit hospital or you have to make ends meet? It means that emergency services might not actually financially make sense. I'm originally from somewhat upstate New York, and the closest emergency room recently just closed because they were covering too many people who were uninsured and they couldn't keep the doors open. Now people have to drive almost an hour to get to the closest emergency room. I mean, I don't think it makes sense for people who are insured or uninsured to have a system that's so asymmetrically incentivized towards providing, maybe expensive but not very useful healthcare.
Yeah, and that brings up the another point that people using emergency care as their primary care is something that's very expensive and is a last resort for people who can't, who don't feel they have the means to afford primary care. And so this is just another way in which we save a tremendous amount of money. Also, by making healthcare available to people who are skipping it. I mean, right now, you know, healthcare is something that you get if you can afford it. Really, there are people who just are up to maybe a fourth to a third of people who in surveys who say they're skipping treatments or appointments or medicines because of the cost. And the toll in disease that brings about. Some have estimated we'd save $200 billion a year in healthcare costs just from that alone. That's separate from the other kinds of savings. Just by taking care of people and instead of letting their diseases progress and fester, when you treat a disease early, it's more manageable. It's less. It makes more economic sense to take care of it early, just from an economic. I mean, let alone a moral standpoint, but just even from an economic standpoint, it's cheaper to take care of people early and give them preventative care that they need to prevent some more expensive and severe complications of their diseases. So in general, when you're talking about inequity, you know, there are so many people who simply can't afford care. And, you know, if you don't have a union, if you have a union job, your union's fighting for you and trying to get you good benefits. If you're not so lucky to have a union job, then you may be getting paid a wage that's insufficient to afford the care you need. And to some extent, the government will come in and, you know, if you have HUSKY or something like that, and really provide the benefits that you should be getting. But you know, again, you know, even if you're a union, if you lose your job, you know, you lose your insurance. That's it. So making healthcare portable, just making it a right that you carry with you, that you're born with, that you carry with you, no matter where your journey takes you in life. You know, you're an American, you know, you have access to healthcare. You know that you're going to be able to get what you need. It's morally right, and it's economically makes a lot of sense as well.
That was great, Justin. Thank you so much, Justin P. Claudette, I see you have a question. Please go ahead.
Yeah, I totally agree with the fact that the emergency room is totally overused, and we have to encourage the communities to go first to their community clinic or their primary care physician. We still have to break the barriers of people in the Black and Brown communities who have that fear of going to their physician based on historical events. And so there's organizations out there like CARE and what Holly is doing right now, and trying to sort of like let people know that like you can advocate for yourself and that things have changed right now. You just got to know your options. You have to speak up and to make change. And going back to like Black women and maternal health, Black women are 3 to 4 times more likely to die in terms of maternal mortality than white women. And that's something that we really, really have to change. But also there's a lot of pregnant women who do not go into their OB until later on in their pregnancy, which can make things more difficult, and they may already have an onset of something. So we've just got to promote that people go in for their care very early in their stages, and preventative measures, just like he was saying.
I'd like to add that this is controversial in many groups, but everyone living here would be covered. That means immigrants. That means people who are not documented. And of course, those are the people who are going to be the very last ones to step foot into any kind of institution because they're scared that that will put them in jeopardy. So a system that just takes all comers without having to prove your identity is going to make access so much better for a broad swath of people living in this country.
Yeah, and I want to say that, I think the immigration issue should really be considered separately from healthcare, because providing healthcare to someone who is ill is just simply a moral issue. And the whole questions that surround immigration and legal status, that you don't handle immigration by denying care to someone who's acutely ill, right? You don't punish people or use that as an incentive. That's not a carrot or stick to be used in the immigration issue. That's just a human compassion. That's something we do because we're decent. And if you want to talk about, employer verification, whatever reforms you might want to make to do with immigration, that's leave healthcare out of it, is my opinion. Healthcare is just something that people deserve.
Well, it's also a public health issue. If people can't afford care, then they are more likely to have illnesses that will affect themselves, their families, and their communities.
And there is a precedent for this kind of thing. I worked for Head Start for many years, and that is a federal program that eligible families can access regardless of immigration status. And though we informally might or might not know whether a family we're giving services to was here, was documented or not, the question was simply not ever asked. And so people, I don't think, hesitated to participate in it. So I'm guessing that there is a way that we could structure a program for healthcare where the immigration status of someone participating would not even be part of the intake into that program. It would just be considered totally irrelevant.
And I do want to, sorry, Holly, I don't mean to interrupt, but I do want to circle back to Claudette's point earlier regarding trust in the healthcare system, especially within marginalized communities. I feel like the thing that I've been struck by in medical school is this history of, I think, justified skepticism towards the US healthcare system. And I really think Medicare for All is one step that we could take towards approaching more trust in the healthcare system, because I don't see how you could get marginalized communities to trust a healthcare system that is designed to make money off of them rather than designed to maximize their health and optimize their health. And so I do think that there is a social and racial justice element to Medicare for All that is very strong.
Very well said, Justin Halloran. Thank you so much for making that point. I've been waiting for that to come out. I'm like, this is so important. This is the most important thing. Of course, healthcare being a human right is important, but we're living in a pretty tough time for a lot of people. So it's very important to make sure that it is a social justice issue for sure. And we have to understand and speak to the fact that people, Black and brown people in particular, have a right to be skeptical of the medical system and the healthcare system because of the history. And until I was with CARE and I went through the community research fellowship program, I didn't understand the depths of the things that had occurred in the past. And I was devastated, to say the least. But so, now knowing the history, it has to be spoken about, it has to be addressed. And I think that I recently saw an article in the New Haven Register regarding bringing high school kids together to push them in a direction or encourage them in a direction into medicine so that more people are in the field that look like them. So I think that's important as well. That has to be addressed, guys. That's an important step as well. But we need to fix the broken, like I said in my testimony that Representative Aurora did not like, we have to fix the bigoted, racist system that is also misogynistic as well. Fix it and put it where it needs to be, and then we can address it. It'll be all set. I would like to talk about how, oh, thank you. No, go ahead. If you wanted to say something further, Claudette, please.
I think you're totally right. The system, like I see the system as not being something that is broken. I see the system as something that's doing exactly what it is meant to be. And just to give, it's set up the way it's supposed to be. So what we have to do is like what we did a couple of weeks ago legislatively. Even though I had a hard time when I was doing my testimony with that same senator, but I'll be prepared for next time. But we have to speak out. We have to speak out. We have to advocate, you know, and get the community involved too, because they need to speak out as well.
Yeah, and I want to echo that idea that you know, the system is in a way doing what it is designed to do, which is to make profits for companies like insurance companies and pharmaceutical companies. They come together not with a mission to provide care to everyone. You know, they have shareholders and they have their obligations to try and maximize their profit. So I think, you know, there are people who talk about, you know, what about the private sector versus the public sector, and there are things that the private sector can do better, perhaps, but healthcare is not one of them. Healthcare, when you put insurance companies in competition with each other to try and maximize their profits, how do you maximize profit? You maximize profit if you're an insurance company by denying claims, and that's what they're good at, and that's why doctors have to spend so many hours on the phone every week trying to argue on behalf of their patients to get the payments they need, because they're fighting against these companies that have a profit motive. And you know, you take that profit motive out, and you get universal care, and you get affordable, comprehensive care. Anyway, so you know, the public sector can have that design, that intention behind it. Our goal here is to provide universal, comprehensive care. The private sector is not going to have that goal. So I think it's important to say this is where healthcare belongs. It's a public good, and it should be under public control. You know, Congress people would have the same healthcare program as everyone else, so they have every motivation to make it comprehensive. You know, their family's going to be getting the same care as anyone, right? Their family's going to be getting the same coverage, you know, as anyone. So I think that really lines up the incentives in a way that makes a lot more sense, and will have a better outcome.
I have to tell you, one of the things that has stuck in my mind and really fired me up even further to advocate for Medicare for all in all aspects is one time I see a hematologist, and hematologists are also /oncologists, which some may or may not know. And she sat down with me, and she looked so flustered. And I said to her, "Dr. LaSalle, what's wrong?" And she said to me, "I cannot stand the amount of time I have to sit here and check off all these boxes. I've got to spend no time with any of my patients today because I had to sit here and fill in all these boxes and check these boxes and make sure that all of my I's were dotted and my T's were crossed. And I can't even sit there and look at you while I do this." And it's ridiculous. And I'm not a cancer patient. She needs to be able to spend time with her patients and not have to do this paperwork in order to be able to continue to thrive in her job. That's not right. It is wrong. And that really, really sparked and fired me up to go. It just broke me that she couldn't spend time. And I know that she does, and she apologizes, and that's why she always runs behind, because she wants to spend that time with her patients, but the current system makes it so she can't. And I think that's important that a lot of people understand it's not always the doctors that are at fault here. And granted, a lot are being brought under the umbrella of either Yale or Hartford Healthcare. And I'm not bashing either. Please don't get that mistaken. It's just that because of the bulk of how much insurance you have to have so many billing people in order to keep up with the demands of what the insurance companies require, that it's too difficult for smaller doctors' offices to compete because they have to have so many billing people and they just can't afford it. So that's how I feel. And I see Claude, go ahead. I'm sorry, Justin.
Yeah, I was just going to say your physician's not alone in that. If you look at job satisfaction of American physicians, a lot of them are struggling with that kind of issue of feeling pressure to not be able to spend as much time with their patients as they want to. And a lot of that time, hours and hours every week, is spent on either on the phone with the insurance company or filling out paperwork, as you said. Yeah, Claudette.
How can we change that?
Medicare
That was the next part. Yeah, that was the next part for sure, Claudette. Thank you. I was going to say, and how we change that is we get involved in Medicare for All, and we do it. Well, I know that everyone of part of PNHP, we are fighting on a national level. Get involved. We here in Connecticut have PNHP Connecticut meetings. You can sign up with Medicare for All Connecticut. You can check on if you're a student, you could do your Students for a National Health Plan local level with Justin Halloran. There's a lot of ways to get involved. You can check out your local, well, we cover health advocacy with Mothers and Others for Justice as well in our health committee. And that's me and my co-chair, Elizabeth, and I can help you steer in the right direction. You could send to info@medicare4allct.org. And Marilyn do you want to put up do you have a Connecticut PNHP email yet?
We don't, to my knowledge. So I'm sorry that we are not that available, but certainly the PNHP national website is an amazing resource. And you can learn a lot just by going to what we have available there.
Is that pnhp.org?
I'll confirm that for you in a minute.
Thank you, Marilyn. And in New Haven specifically, we're working on a New Haven Medicare for All resolution. And you can actually, I don't mind, you can reach out to me or just do info@medicareforallct.org, and that comes to me as well. And I can certainly point you in the direction of each person or everything that we're getting involved with. And we will point you in the right direction with whatever advocacy in Medicare for All you would like to get involved with. Oh, I have 2 questions. Okay, Rana, go ahead.
It isn't exactly a question, but since you brought up resolutions, New London was the first town in Connecticut to pass a resolution in support of a Medicare for All program, either in the state or nationwide. And it passed unanimously a year ago, actually before in an in-person meeting, if you can believe it, before COVID. So even before things got quite as bad as they are now. And part of the reason it passed unanimously was that we did an estimate of the numbers, and 15% of the New London budget, approximately, which was, our tax rate is very high, it's almost 40 mils. And we estimated that between 8 and 9 of that 40 mils goes simply to the city paying its own employees and retirees' health insurance benefits. And that's very volatile. In 2019, the premium went up 29%. That was not with improved coverage. And the city had to make a decision whether to raise taxes or to find, things to defund to pay the insurance companies. Municipalities all around the state are doing that. And the more municipalities take that stand, it becomes a big constituency for change. Our Congress people at the national level and our state legislators as well, they can listen to citizens too, but if like half the towns in their districts pass these resolutions, then that would give us a little bit more leverage. So I highly encourage it.
Okay, we have Claudette and then Justin Paglino, which I'm sorry, Justin, I totally forgot about your information too. My apologies. So go ahead, Miss Claudette.
I'm sorry, Holly. Justin, you can go ahead. I forgot to put my hand down.
Wait, unmute. There we go. Yeah, no, I wanted to also mention National Nurses United is another group. If you're a nurse and you want to get involved, there are so many groups fighting for universal health care. I mean, this country's been fighting for universal health care for a long time. And we're just going to keep fighting until we can get it, right? I mean, since Harry Truman, proposed it, and maybe even before that. So we have, I am running for Congress in part because not everyone knows that, my representative in Congress doesn't support Medicare for all, and that is Representative Rosa DeLauro. And she has her reasons, but, I don't agree with them. I think we need Medicare for all. I want to save lives and save money. I want to see universal health care. And she has her arguments, but I just don't think they stand up to the arguments in favor of universal, single-payer, comprehensive health care for all. And so that's, something I really believe in, and that's why, I fought to get my name on the ballot in the 3rd Congressional District so that people who want Medicare for all can make that known at the ballot, so that they're not, when you vote for something on the ballot, you're not just signing a petition. Petitions are great. You're not just writing a letter to the editor. You're putting your vote where your beliefs are. You're saying, I want the leadership that's going to give me what I want. And your vote's a very important thing. And I encourage people to use it wisely and think carefully about who you give your vote to. We have in the state 5 Congress people. Only one of them supports Medicare for all, and that's Johanna Hayes. And the other 4 do not. And some of them are going to be getting primaried because of that. And I encourage people to support those challengers. And, among our senators, it's only Richard Blumenthal that supports Medicare for all. At least that's 1. 1 out of 2 is better than none. But we don't have Chris Murphy on board. So, this is a federal bill. This is a federal issue. There's a bill in the House. There's a bill in the Senate. In the House, it's HR 1976. Talk to your legislators. Ask them, why do you not support this? And really, I believe if your representative doesn't represent you and they're not going to change their mind, then you've got to change who's holding their seat. And you've got to get somebody in there who's going to, when it comes time and that person is asked, do you want to co-sponsor this bill? They're going to say yes. And that would be me. And that's not hard. I don't have the experience Rosa DeLauro can boast, but I have the ability to do something that she is not willing to do, which is just to unapologetically say, yes, I vote in favor of Medicare for all legislation. So that's how change happens, is we've got to get the leadership who's willing to go in the direction we want them to go in.
I agree, Justin Paglino. And also, we as Medicare for All Connecticut, because we only have one person in federally that supports HR 1976, we are also trying to fight on a state level along with the resolutions. And we have HB 5340, an act concerning establishing a single payer healthcare system in Connecticut, that unfortunately died in committee because, well, there's a lot of things that go on in the background in legislature that we learned about that I didn't quite want to know, but that's okay. And we were very successful in running a campaign for Senate Bill 1090, which was for doing a study for a single payer universal health care program, which is a huge win. And so now no one can say to us, oh, that's just going to be too expensive. Well, now we will find out the truth, whether or not it will be too expensive. And that is also something you can lend your voice to. We still need to get it on the floor and voted upon. So you can always lend your voice to that in local, state, and federal levels. And like Justin P. said, we definitely, your voice is heard. And we need to have more people's voices heard. And it's extremely important that your voice is heard. And always reach out. Like I said, info at Medicare, the number 4, allct.org. PNHP.org is the federal information website. Justin, could you say your website again, please?
I'm at justinforall.org.
Thank you. And so reach out. We can help you with state, local, federal level, and please, we would love to have more people on board. Let's see. I think there are a few other.
Oh, I just wanted to say, I think that's really amazing what you guys at Medicare for All Connecticut has been able to accomplish with SB 1090. I mean, this is, I got the number right, didn't I? 1090. And that's also called HUSKY for All. So, and it's very similar to, what Medicare for All would be on the federal level, but it would be statewide. And so, to get that bill supported by a committee is no small accomplishment. It requires a lot of pressure. And I know Medicare for All, there's a lot of people in the group who've been working very hard. And, anyone listening who wants to get involved in the fight for Medicare for All or Husky for All, Medicare for All Connecticut is fighting both those fights very effectively, in addition to the other organizations we mentioned. And, you are more than welcome to please join.
I also want to encourage people that this is in no way a lost cause. As you can hear, there's a lot of fire, there's a lot of people, there's a lot of organizations. And what is some people would find surprising is when you poll the citizens of this country, not only is it a majority of us who favor some version of Medicare for All, but a majority of Republicans favor some version of Medicare for All. A majority of physicians are in favor of some version. So there's definitely momentum. I thank Joe Biden for funding the Obamacare at a higher level for the next couple of years, because that means millions of people will get access while we try to get the major systemic change. But it's a good stopgap, and I'm grateful to him for that. But it is nowhere to stop. We got to keep moving.
I wanted to just kind of point out that many of us have kind of experienced a little piece of what universal health care could be in terms of the federal and state response to COVID. I mean, we can go, I know the system is fragmented and it's a pain to schedule your appointments, but if people want to test, we don't have to show an insurance card or pay up front for it. And the same with the vaccine. I mean, I think if we had more of a universal system, people wouldn't be, calling 6 phone numbers and going to 5 websites and maybe finding a shot, 5 minutes away from their home and maybe having to drive an hour. But if you want it, there isn't a financial barrier and there isn't the same sort of administrative barrier that you would have getting other medical care. So if you would like to have a similar experience when, if you needed a shingle shot or if you, slipped and broke a bone, then that would be it's sort of an example of how things might work. And I did want to just point out with the state Senate Bill 1090, it is actually a bill authorizing an economic study of a HUSKY for All system in Connecticut. And there's actually been a lot of pushback, so-called conservative pushback, but it isn't really conservative. I think there are people with special interests who want to keep the profit motive in healthcare because they're somehow attached to the profit, and they don't even want to see a study that shows that competition doesn't work for healthcare. So really, I do encourage people to contact their own legislators in the state Senate and the state House, as well as the committee leaders and the House, the leadership in our legislature, to let them know that this is really important. And if Connecticut is going to provide what we need in a financially responsible way, this study is a really vital first step to it.
Yes, it is, Rana. Thank you so much. And Claudette, you have a question or a comment? Go right ahead.
Thank you, Holly. I grew up in the UK, so I was part of universal healthcare system, the NHS. When it's a system where you can get an appointment, there's 24-hour, there's night doctors that will come out if you can't go to your home. Your prescriptions are free, your surgeries are free. Everything is free. The only thing that can mess that up is government who tries to privatize most of the hospitals, and then that will kind of make the shape of the NHS system totally different as it is in the UK. But overall, it's a very, very, very good service. You can look at the Canadian version, which is doing a lot better than the UK version. And you can always see somebody, psychiatrist, maternal health, nutrition, and the appointments are not very hard to get. You just call up, you select which doctor you want to see. And I don't see why it shouldn't be here also. USA being almost #1 with medical in the world. Why can't we have a universal healthcare system? Why does people have to profit from poor people with the Medicare and everything, and making everything so difficult for you? All that money that could be saved from insurance companies can be put right into the services to make it a lot more accessible and a lot better for people in the community. So this is why I'm 100% for it. The senator a couple of weeks ago, he made the example of saying that his aunt was ill and had a heart problem and she couldn't get the surgery. But what he failed to say is that aunt may have had underlying issues as to why she couldn't get the surgery. And that's if there was an aunt at all. You know, he could have been just saying that. So there's ways around things that they're not going to put your health at risk just because, you know, they're there to help you and do preventative measures. So that's what I had to say on that. And I hope the senator is listening.
Thank you, Claudette. I highly doubt State Rep Aurora from Greenwich would be listening to any kind of a progressive radio show. Okay, well,
Maybe
in closing,
we should send him a copy.
Good idea. In closing, I would love to say, please, everyone, get involved, because without everyone's voices, we will not make the change that is necessary to make our entire country a healthier, happier, more productive, and financially secure country. And I'd like to thank all of my guests. You are all in good trouble with me. We all do great trouble together, as the great John Lewis would say. Good trouble is the best kind of trouble. So I thank you all so much for joining me, and I hope we have helped more people understand Medicare for all.
Thank you, Holly.
Thank you, Holly.
Guys, that was great.
Yeah, thank you.
As I got another rhyme, another rhythm for y'all to listen. I'm never quitting on my mission. I'm gonna roll with what I'm giving. Got some ambition. This is Harry Groves, and you're listening to WNHHLP 103.5 FM in New Haven. In the moment you stressing, but you gonna be counting blessings. And I know that for certain. Keep on working, open curtains, haters swerving, cause they ain't ready for your final version. I'm never gonna give up. Fall down, I just gotta get up, yeah.